Hi, my name is Dr. Jae Chun. I'm a board certified plastic surgeon practicing in Newport Beach, California. I've been in practice 23 years since I completed my plastic surgery residency at USC in Los Angeles, California. I'm grateful to have this opportunity to address the members of the FDA regarding breast implant problems. I've had very diverse practice throughout my career. However, in the last 5 years or so, becoming more and more focused on breast implant removal surgery to the point where in the last 3 years, my practice is 100% devoted to the implant removal surgery, and the demand has been increasing. My typical patient presents with either saline or silicone implants. They usually have vague neurologic and connective tissue disorder types of symptoms. These symptoms have been reported by the manufacturers to the FDA. These symptoms are well described in the brochures, and I'm going to just read you from the manufacturers. And this was Mentors, where they present with, quote, various rheumatologic signs and symptoms such as fatigue, exhaustion, joint pain, swelling, muscle pain, cramping, tingling, numbness, weakness, and skin rash, end quote. Reading from the Allergan's brochure, quote, some women with breast implants have complaints of neurologic symptoms such as difficulties with vision, sensation, muscle strength, walking, balance, thinking, and remembering things. And a quote from Allergan's brochure, quote, for primary augmentation patients at 10 years after implantation, comma, statistically significant increase after accounting for age were found for symptom category of skin, urinary, and others. Despite being well documented in the manufacturer's own documentations and brochures, these women are still routinely told by everyone that there's nothing wrong with them, they're perfectly fine and healthy, and perhaps all in their minds. They're often told that breast implants are the most studied medical device ever, and they have been definitively proven to be perfectly safe. This view has been expressed by various experts associated with manufacturers. Therefore, it disseminates down to plastic surgeons and other specialties, primary care physicians, and it is not a surprise that the vast majority of my patients, after undergoing numerous diagnostic tests and having tried all the various treatments, are increasingly turning to functional doctors because the conventional medicine is telling them that there's nothing wrong with them, that it's all in their heads. But is it really in their heads? Again, if you look at the manufacturer's brochures, the incidence of these problems that have been reported in the core studies range anywhere from 1.4 to 2%. The memory gel breast implant core study done by Mentor found that almost 1.8% of patients had these symptoms at 6 years. So these are not imagined symptoms. These are not people just getting older. These are not women undergoing menopause. These are real symptoms. In the same brochure, the manufacturers offer a rebuttal by stating, quote, a panel of expert scientists found that the evidence linking neurological diseases with breast implants is insufficient or flawed, end quote. And the reason why they resort to the expert panel's opinion is because they realized, quote, the study size needed to conclusively rule out small risk of connective tissue disorder among women with silicone gel implants would need to be very large, end quote. Meaning the study cannot and did not rule out the connection between the two. They're just simply going by the opinions of the experts who've stated that there is no connection. That's not the same thing as studies showing that there is no connection. When we talk about small incidences, such as 1.5 to 2% cases of subjects with these types of symptoms, I'm very aware that every medication ever approved by the FDA has similar complaints of various vague signs and symptoms associated with them. But we have to make a distinction between, because for that, you just simply discontinue your medication or you just don't take it anymore, and that solves the problem. Here, the device is already in place inside the body. So when 1.4 to 2% of the women start having problems, the only way to fix that is by having another surgery. Again, 1.4 to 2%, that's considered small risk. But when we have almost 10 million women with implants, that represents anywhere from 140 to 200,000 women. That's a significant problem. I don't know of any other devices and medications that the FDA has jurisdiction over that causes problems in 140 to 200,000 women. Going back to my practice, the main reason why I decided to focus solely on performing explantation surgery is that as I was starting to do more, I was also starting to get more consistent follow-up on a daily basis. And what I was starting to see is a significant improvement. I would say somewhere around 80–85% of my patients were feeling better. They were, back to their old selves. They're once again functioning members of the society, whereas prior to the surgery, they really weren't doing anything anymore. Their symptoms were so debilitating that they ceased to function at their previous levels as mothers, as wives, as workers in our society. The patient population that I'm operating on have been told by the conventional medical community that we don't know what's wrong with you. We've done all the testing, we've done all the treatments, nothing seems to help. Maybe it's in your head, we don't know what to do with you. In this patient population, by removing their implants and taking out all their capsules, I'm seeing significant improvement in 80 to 85% of the patients. If this surgery was a sham surgery relying only on placebo effect, as many have claimed, you have to ask yourself, in this day and age of internet and social media, where information exchange is at the speed of lightning, essentially, and also the information is expressed in a totally anonymous fashion, you're going to start to see people saying the emperor has no clothes. That surgery does not work, and other people will start to chime in. Pretty soon, that will be exposed as a fake surgery. And we're not seeing that. And it's not just my practice. Other doctors that are devoted to this surgery are seeing similar improvements. They're not seeing many women saying that conclusion. I would like to say that the evolution of my practice from a very diverse plastic surgery practice to a practice focused solely on the implant removal has been very rewarding, mainly because of the improvements that I'm seeing in patients that were quite debilitated prior to surgery. Now, clearly, an individual's practice will not offer any definitive proof that large studies were not able to discover. But what I find troubling is when you actually read the core studies that have been done, the conclusions that are stated there are not consistent with what the companies and the experts associated with the companies are expressing to the public, which is completely safe. Their brochures, the information expressed in them, and the information submitted to the FDA clearly do not state that. It says 1.4 to 1.8% of the patients have these problems. And when you consider that there are almost 10 million women with implants, that's 140 to 200,000 patients. And in my practice, those patients seem to get better. So in my mind, there is no doubt that the implants are causing these problems. I would like to thank the members of the FDA for letting me express my views. Thank you.